Hey guys, welcome to day 27 of our March Madness practice questions. As always, I like to get into my intro and disclaimer before we get started. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, courses, videos, tools to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally, going from unsuccessful to successful on boards and excelling in practice as our new novice NPs. But I always like to give a disclaimer before I get into any material that we know that there's no absolutes in medicines. We treat on a patient by patient basis, and any questions or things that I provide to review with are based on the current guidelines that they are testing on this current exams, the ANCC as well as the AAMP. And if I'm talking about things for practice purposes, I will say those things so that there's no confusion. All right. So with that being said, let's get into question number one for today. All right. In mid May, a patient presents to the office today for follow up. The patient has a history of COPD and diabetes. He currently takes Atrovent PRN, Spiriva, and metformin. Today, his FEV1 is 42%. Based on these findings, how should the nurse practitioner treat? Is it A, add pulmonary rehab and budesonide? B, no changes are required at this time. C, add a flu vaccine, pulmonary rehab, and formoterol. Or D, add formoterol and pulmonary rehab. Take a moment and tell me what you think in the comments. All right, I always recommend reading the stem of the question first so that it slows you down and ensures that you're answering what is even being asked of you. So, here, the stem of the question states, based on these findings, how should the nurse practitioner treat? Remember, I always talk about we study in the fashion of assessment, diagnosis, evaluation, and treatment. This is how I do all of my courses, my review book, and I really, focus in on that just because of that's how the test evaluates us. That's how we practice. That's how we document, right? So if they're asking you how do you treat, you have to take a step back, look at the diagnosis, look at the assessment on how they present it, looking at those subjective and objective findings, right? So here the patient came in just for follow up. They have a history of COPD and diabetes. His FEV1 is 42%. So wait, that's a pause for you, right? So now you're trying to think. So you remember when I'm talking COPD to you guys, I always tell you think of your ranges. With any of the ranges, I'll tell you to think like this. So there's four of the stages, correct? And there is a with any range, so to speak, a higher scale, lower scale, and then the rest kind of fall in between. All right, well, with COPD, on the better end, the higher number with stage one is FEV1 greater than 80%, right? Then stage two goes down about 30. And so it's 50% to 80%, right? The FEV1 falls anywhere between there. Then stage three is your severe stage, right? And the FEV1 is anywhere from that 50% to the 30%. And then stage four is the very severe stage and it's less than 30%, right? So here, this FEV1 is 42%, which puts them in stage three, the severe category, right? So in the severe category, how do you treat? And this is how you should walk it backwards to figure out your answer choices. So in the severe stage, we treat, they should now have a SABA or SAMA PRN on board, which they do, Atrovent PRN. So that's a SAMA, right? So check for that. So then they should have a llama or lob on board. And for testing purposes, just stay in the drug class. If they have you on a short acting muscarinic agent, then the long acting should be muscarinic. I know in practice we can do either or, but for testing purposes, they typically try to just keep you on the same drug class to prevent any confusion because they're trying to make sure that you know how to do and you're competent enough on the entry level. So we have our short acting muscarinic PRN, which is your Atrovent. Spiriva is your long acting muscarinic agent. So check, check, right? We do our Short acting, long acting, flu vaccine if it's flu season. It says it's May, so it's not flu season, so we don't need the flu vaccine because flu season is when? October through March, right? And then you do pulmonary rehab and an inhaled corticosteroid, right? So your best answer here is to add your pulmonary rehab and budesonide. A is your answer. Okay. So whenever you're doing COPD, walk it back. And I know it's a lot of those steps. They absolutely just build on each other with COPD. In the stage one, you're just having that short acting PRN and a flu vaccine if it's flu season. Stage two, now you're adding in the long acting. So you keep everything. We're not eliminating anything. We just continue to add as we build up. I have a video on that, but I just recommend writing it out. And if that's one of those things you struggle with, just continue to write it so that you can easily pick through and answer questions just like this. Okay. All right. Question number two. A patient presents to the office today with complaints of otalgia. After assessing the patient, the nurse practitioner diagnoses the patient with acute otitis media. The patient has a penicillin allergy. Based on these findings, how should the nurse practitioner treat? Is it A, Bactrim, B, ciprofloxacin, C, azithromycin, or D, augmentin? Take a moment and tell me what you got in the comments. All right. Stem of the question states, based on these findings, how should the nurse practitioner treat? Again, we're talking about treatment, so you need to take a look back at the assessment and the diagnosis. How do they present? Do we have a diagnosis or are we figuring out a differential? So here they came in with otalgia, classic, for acute otitis media, and they are diagnosed with acute otitis media. All right, so then you're starting to think of ways that we treat this, thinking all the way through, but also it's a note to keep in mind that they have a penicillin allergy. All right, so with acute otitis media, I always tell y'all to think of the A's, right? The A's. So first line therapy is amoxicillin. You typically do a little standard dose of um, standard to high based off of the severity. First, truthfully, you're treating symptomatic management with your analgesics, but you give your amoxicillin if warranted, if they based on being on antibiotics in the last 30 days, you may need augmentin, the combo of amoxicillin and clavulanic acid at a high dose. So first line is amoxicillin, second line right there is augmentin, depending on, sometimes it's utilized first depending on those criteria I just mentioned. But if they have a penicillin allergy, then you go with azithromycin, or first line cephalosporins like the ceftanirs and things of that nature, but most commonly azithromycin. So I always say, think of the A's. My Brittany's brilliance. I say, think of the A's: amoxicillin, augmentin, azithromycin. For the acute, start with an A, otitis media. Okay. All right. And third question for today. The patient presents to the office with complaints of left ear hearing loss. Upon assessment, the Rhine exam shows bone conduction is greater than air conduction, and the Weber exam shows lateralization to the left ear. Based on these findings, how should the nurse practitioner diagnose? Is it A, otitis externa, B, sensory neural hearing loss, C, conductive hearing loss, or D, acute otitis media? Take a moment and tell me what you wrote in the comments. All right, stem of the question states, based on these findings, how should the nurse practitioner diagnose? So if we're diagnosing, you need to take it back to assessment, right? See how they present themselves, their signs and symptoms, their subjective, the objective of what the nurse practitioner is observing and assessing. So here the patient comes in, the way they're presenting is stating that they have left ear hearing loss. All right, so now the nurse practitioner is furthering her assessment, completing that with Weber and Ryan. Ryan shows bone conduction is greater than air conduction. We know that's an abnormal finding. It should be air conduction is greater than bone conduction, right? By a 2-to-1 ratio. So okay, we're starting to think conductive hearing loss potentially. Weber, let's clarify and make sure and confirm this diagnosis. The Weber exam shows that there's lateralization to the left ear. All right, that's confirmation for C, conductive hearing loss. Um, so with these hearing loss tests, and I have videos on this. Go check it out if you struggle with this to get a breakdown, because you really just have to think through it, practice it. But thinking about it with the Renee, people call it all different things. I don't know. This is what I call it, Rhine. With the Rhine assessment, this is checking on the air, the conduction of the sound. And so you're going to strike your tuning fork, place it on that mastoid bone, and you're going to ask them to let you know when they no longer are able to hear that vibration, that vibratory sound, right? So then after that, then you place the tuning fork in front of their ear. This is assessing the air conduction, right? So if they don't hear a sound at all when you move the tuning fork in front of their ear, that's letting you know that bone conduction, because you move from the mastoid bone, the bone conduction is greater than the air conduction. All right, so there's something here causing this, correct? There's something blocking that conduction. All right, so then we go to Weber. And so when you do the Weber exam, you're going to strike your tuning fork, place it in the center of their forehead at the top, asking them if they hear if the sound lateralizes to either ear. It should not. They should hear it equally in both ears. But with conductive hearing loss, the sound will lateralize to the affected ear, to the ear they're complaining about. So here you see that is what happened. The sound lateralized to the left ear that they complained of. Whereas with sensory neural, the sound will lateralize to the unaffected ear. So if it would have said that the sound lateralized to the right ear, and he's here in this scenario complaining about the left ear, that would have been sensory neural. Okay. Um, so then, you'll proceed to see what's causing this conductive hearing loss. But in this event, the answer is C, conductive hearing loss. Go check out that video on Weber and Ryan if you need assistance with that. But I hope that this was helpful for you guys. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But be sure to meet me back here. Y'all been sticking along for the ride for our March Madness daily practice questions all month long. I'm debating because I usually, my usual flow is we do topics and tips on Tuesdays. We work out practice questions on Wednesdays. Thursday, we tie it together to help you apply it for practice. Fridays, it's usually like a flashcard Friday or a freestyle of something to help you. So let me know what y'all want. Do you want me just to continue doing daily practice questions all the time? Or do you want to go back to the regular way? So just let me know. Let me know. Let me know. But if you need us for any additional assistance, if you're needing any of our review courses, our online self-paced courses, our upcoming 5-week intensive, the next one is on April the 8th. And this Friday, March 29th, is the last day to enroll in that. Or one of our one-on-one sessions to help you go from unsuccessful to successful, or if you just simply need to make some of your weak areas your strengths, right? Just give us a call at 803-400-6864 or shoot us an email at the nursingstudio1@gmail.com. I've also added links at the top of the page so that you're able to see and easily access a lot of these things that I am referring to, so you know how to contact us. All right, you guys, happy studying. Meet me back here. Bye, y'all.